Hello everyone, welcome to the Somnath Show. In this episode, I am immensely honored to have a very distinguished guest, Professor Tony George Jacob from the prestigious All India Institute of Medical Sciences, New Delhi. So let's give a warm welcome to Dr. Tony. Thank you, sir, for your time and welcome to this platform. So, coming to the teaching side, okay, because these days we have come with advanced technologies and all, we have understood the human anatomy at a depth, and these instruments are developing. We know over a period of time they have come up. So, how easy it is to understand a human body these days compared to, if you see 10 years, 20 years back?
So the detailing is always there. There's a lot of details that keep on increasing about the human body, and particularly in the surgical fields, that becomes even more important because they keep finding ways and means to navigate the intricacies of the human body.
Right.
But today, particularly with the kind of students that we get at a medical school who are learning about the human body, they're all adults.
Yeah.
And therefore, the paradigm of teaching has shifted. It is no longer supposed to be, this guru standing on a stage and delivering a pravachan or this grand sermon on a particular topic. It is also more about respecting the fact that the other person who is in the process of learning is also an adult who is willingly come to this place to study.
Yeah. Yeah.
And therefore, it has become more of facilitation. The facilitation of the learning process becomes extremely important. So, we expect a lot of our adult learners to be self motivated and self directed. It's a little difficult when it comes to an undergraduate student because they're fresh out of school and their method of teaching and learning in school is still very often didactic.
Yeah.
Didactic and very focused into a particular domain. Like when you're learning algebra, you're only learning algebra and so on and so forth, and you're doing it at the behest of a teacher or a tutor. I strongly feel that there is a reason why our terms of reference changes with years.
Yeah.
For example, if I may use Hindi or Sanskrit, we start with a pathshala, which is a small room in which learning takes place. Then you get into a vidyalaya,
Yeah. Yeah.
which is still a closed environment in which your learning process is taking place. Once you reach university, it's Vishwavidyalaya. It's no longer confined to the boundaries of a particular building. And even in English, the word is university. The entire universe can be your teacher. It's up to you to find what is it that you're interested in, how you want to go about doing it. And your method of learning may be very different from my method of learning.
Right.
And there would be a prescribed curriculum, but how you achieve that curriculum and the objectives of that curriculum can be facilitated by a teacher, by a faculty, and so on, or by a senior resident, and so on. But at the end of the day, the navigation has to be by you.
Yeah.
Because your method of learning may be very different from your neighbor's method of learning. Your method of understanding the way that your wiring of your brain has taken place may be very different from another person. Some people may have extremely auditory memories where they like listening to things before they analyze it. Some people have very visual memories. Some people have a lot of associative memories where they would connect one thing to the other and then they remember things. So there are different kinds of methods of learning. And you can't say that, okay, this is the best or this is the best. There are multiple ways, and what is suitable for you to function most efficiently is best for you.
So, but Indian medical system, the way it is being taught here, does it foster this?
Tough question. Tough question. Particularly in the realm of my subject, that is anatomy, very often it just becomes an extension of school,
Okay.
unfortunately. But that said, in medical education, the principles of medical education do follow the Miller's pyramids, wherein one builds on basic cognition, that is, basic knowledge, then your understanding and applicability of that knowledge, that is, knows, then knows how.
Yeah. Yeah.
Then, when it comes to a skill, it's about showing and showing how. So your ability to explain things also becomes important. So higher cognitive thinking and higher skills, psychomotor skills, are definitely part and parcel of designing the curriculum, particularly with the new competency-based medical education curriculum. That said, but how we assess the highest level of abstraction is still not standardized. And therefore, it is very institution specific, sometimes department specific, sometimes person specific. And therefore, there is this randomness that is there in the evaluation process. And unfortunately, it's the tail that wags the dog in our country. So, at the end of the day, it would be the students' ability or their performance in a particular exam that would determine their success or failure, unfortunately. And this is something that I keep telling my students as well. When you go and visit a doctor, how many of you actually ask them for their marks? How many of you actually ask you for your degrees?
Yeah.
You don't.
True.
The reason why we go to a doctor is essentially because of their reputation.
True.
And on what is their reputation based?
They're well treated to most of the patients.
How they are able to solve problems.
Yeah. Problem solving.
A function of a professional in society is to solve problems. It could be a legal problem, it could be an architectural problem, it could be an engineering problem, it could be a medical problem.
True. True.
So when that person comes to you with a problem, your ability to solve it and communicate it effectively is going to set your reputation. And in the medical domain, your ability to solve problems is based on multiple algorithms of multiple variables. And whatever knowledge that they're acquiring during their years of study is actually building in factors and variables over there.
Yeah. Yeah.
And the larger your algorithm, more effective is going to be your problem solving.
Yeah.
The more number of variables that you can factor in over there, you will have a closer approach to the actual diagnosis than just a differential diagnosis.
Yeah. Right. True.
So, very often students, when they're 18 to 20 years of age, they don't understand about the importance of what they're doing in life. They don't understand the importance of building a reputation. That whatever that they're learning today is an investment into their reputation in the future. Why? Because their reputation is going to be entirely predicated on their problem solving skills.
True. True. That's no. My observation is, in a school, if you see the backbenchers, eventually they turn out to be more successful in their life.
Again, anecdotal. Again, anecdotal.
That's what
It's like 1% of the brain that is being used.
No, that's true, sir. I'll cut it off.
Yes.
Yeah, that's true. Okay, so then the students, as you said, the evolution and students also has happened, right? The type of students when you see 10 years back and these days, has there any changes in them in terms of how they want to take medical sciences as their profession?
The motivation, no, but the means, yes.
Okay.
So when you have, I think it's essentially a problem with the way society is engineered today. So particularly in the urban to semi-urban society where you have a lot of nuclear families, children are very often kept at the center of their family.
Right.
And particularly in the middle class segment, which goes for this kind of education,
Yeah.
the parents often feel that the measure of the success of their child is going to be entirely based on their ability to crack some competitive exam or the other.
Yeah.
And thereof get into a particular profession and so on. And so in these families, the children are often kept at the center of the universe, where they're not given any home responsibilities. Very few are given.
Yeah.
They're only supposed to be studying, going for tuitions or some extracurricular activities and so on to build a CV to crack whatever is the objective of the parents.
Yeah. True.
And therefore, we get an entire cohort of students that feels as if they are the center of the universe.
Yeah, I am the most important person around.
Exactly. And it becomes a reality check and a culture shock to them when they come to a place where everybody is equally entitled. And the faculty don't give a damn about how important you may think you are.
Yeah, true.
And that often creates a lot of adjustment issues inside their heads as well. That, okay, I'm not getting what I think I deserve. Or I'm not performing as I intend to, or my parents intend to.
Okay.
And that creates a lot of issues.
I get that. Depression is also a part of it.
Maybe anxiety and depression would be a part of that spectrum, but at the end of the day, it is essentially because they've been trained to respect those numerical metrics of success.
Yeah.
That means if you don't get 75% or a distinction in a particular exam, you will be treated as a failure. If you're not at the top of the class, which you were throughout your schooling,
Yeah.
you're a failure.
Yeah.
You're not. But that is an understanding that they've been brought up with. It will take an enormous amount of social engineering to let these students know that no, that is not a measure of your success. Tomorrow, the number of people who are going to be holding you as a relevant part of their lives because you help them solve problems is going to be a measure of your success. How many people understand that?
True. It's a very, very pertinent, I think explanation which you have given, sir. And I think these days youth should understand this at a depth.
But it's not something that a lot of parents are willing to take a risk on
Okay.
because there is a limited time that they have with their children. And in that limited time, they want maximum output. And that maximum output today in society is based on, again, these numerical achievements.
Yeah.
That, okay, 95% or 99% or admission
In a
into.
society, I know many people, they say, my son got 95%. How much you got? So it's more like, if that person got 94%, the other person is, ashamed to say that my son got 94, your son got 95. I said, that is how in a society it's a matter of prestige and reputation, even for the parents also, with those matrices.
Because they're considering those matrices and those metrics to be important, right? Anything is only as important as you give it value. If you think that your child's well-being is more important than the marks that they achieve, your approach to your child is going to be very different. You take the case of Gukesh, who's become the youngest grandmaster in the world in chess.
Yeah.
He left school, regular school, since he was in class 4. At that time, his parents recognized his ability at chess. His father also left his job to be able to look after this ambition of their child.
True.
How many parents are willing to take that risk?
Service, yeah. That doesn't be.
So it's a big risk. It's a big risk. And sometimes a lot of people actually prefer to play it safe, especially when it comes to their children.
Yeah. Yeah.
Especially since it's a nuclear family.
True.
And those are expectations, I guess.
Yeah, that's true, sir. I think this is going to be a eye opener for all those people who will be listening this podcast, because this is, everybody should listen to this, and coming from you means a lot, because we are in a rat race. So be it parents, be it students starting, and this rat race culture has come so deep inside that we are forgetting the overall objective, as I said, problem solving attitude. So we are more like we are a problem for ourselves, and these matrices are our measurement that how successful I am, or how failure I am, right? So we should come out of this vicious cycle.
I hope so. I hope so. Yeah.
True, because when you have wonderful teachers like you around, I think definitely this message sooner or later will penetrate across different people, and then they will hit some right chord will hit inside them, and they should think about it. That's the motto here, sir.
Fingers crossed.
Fingers crossed. With that note, sir, thank you for your wonderful insights which you shared with us. Thank you for your time, and I'm saying, I'm immensely honored to have you in this. Thank you for your time, and then I have no other words to express my gratitude for your time. Thank you, sir.
But thank you, Somnath, for allowing me to air my views.
Sure, sir.
Not that I'm shy of it, but yes.
Yeah.
Thank you very much for this opportunity. It's a pleasure talking to you.